The goals of the article that we utilized for this study was an emphasis on proper progression for post-scaphoid fracture, whether it was casted or post-surgery. With post-scaphoid fractures, it's vital to recognize signs and symptoms early to avoid avascular necrosis. This article found that for the best results, continual reassessment throughout the rehab process is vital. The goal of the study was to restore range of motion as well as hand and wrist function with a focus on ADLs. The focus for this video is to present 4 exercises that can progress a patient through wrist injury rehabilitation. Though the article specifies exercises for stretching, strengthening, and plyometrics, we are only going to demonstrate strength and plyometric exercises. With multidirectional isometric holds, the patient will hold flexion, extension, radial deviation, and ulnar deviation. Each one of these can be held for 10 seconds apiece and repeated 10 times in each direction. The patient can then proceed to do this 2 times a day. A Phase 2 strength exercise is the towel twister for both flexion and extension. These can be performed 10 to 15 times in each direction for 1 to 3 sets. Starting with flexion, twist the towel so the affected wrist has tension in the flexed position. In this case, it is the right wrist. Proceed to flex wrist, placing more tension through the towel while extending the contralateral wrist. Twist the towel in the opposite direction to focus on wrist extension. Repeat 10 to 15 times for 1 to 3 sets. Phase 2 plyometric exercise is the unweighted ball toss and catch. Repeating 15 to 20 times, have your patient catch and toss a ball, emphasizing eccentric and stabilization control. Before an athlete begins medicine ball exercises, they must be able to throw and catch an unweighted ball. The idea is to retrain the athlete with the mechanics of throwing and catching without pain before loading the muscles. Once this is achieved, the athlete can begin to load the joint with weighted medicine balls. Phase 3 plyometric exercise is the medicine ball chest pass. By using a 6 to 10 pound medicine ball, the patient performs chest passes in a rapid manner. This low-intensity plyometric exercise emphasizes strength and stability as well as return to sport. Have the patient perform 10 to 20 reps for 1 to 3 sets.